Hi, my name is Yan Chen, and I'm here to talk to you about Kyrgyzstan and their healthcare system. So let's get started. Kyrgyzstan is located in Central Asia, which is right there where the dark green country is, right between Uzbekistan and China, and right under Kyrgyzstan and all those other Stan countries. Kyrgyzstan has about 5.72 million people, and out of a group of 10, it could probably only provide health treatment to 2 citizens. The country is lacking educated and experienced doctors as well as insufficient medical equipment to treat their patients. What are people going to do if they can't receive the help that they need? Imagine not receiving the right medicine, vaccination, prescription, or treatment that you need when you're sick. This could only lead to frustration and more problems. After gaining independence from the Soviet Union in 1991, Kyrgyzstan was no longer able to support their own healthcare system. The chart shows the amount of resources the emergency room in Kyrgyzstan has. Most emergency room in Kyrgyzstan only has 1 or 2 of each equipment. That's sometimes barely enough to help 1 patient, let alone 5.72 million. This just shows how Kyrgyzstan cannot afford to get resources to provide for their people in need. Having a bad healthcare system leads to poverty, death, starvation, and corruption. Even though the government owns the healthcare system and has regulations and rules for medical practices, that doesn't stop the illegal pricing and upcharge the patients of doctors, which leads to corruption. Did you know that a doctor only makes about 18% more than a technician worker? Due to the low wages, many citizens do not pursue to become a doctor, and most of them change or choose a career to and with a higher income. This chart shows the amount of doctors in Kyrgyzstan per 1,000 population from 2009 to 2011. In 2009, Kyrgyzstan only had 2.4 doctors to every 1,000 people. If we thought that was bad, as the years went on, Kyrgyzstan eventually hit 1.96 doctors per 1,000 people, and it had remained at 1.96 since 2012. Kyrgyzstan has been trying to improve on their healthcare system by teaching healthcare workers medical practices every day. In the early 2000s, they even had 2 healthcare reforms which improved their healthcare system immensely, but sadly did not last. The government needs to give a lot more funding to the health sector in order to bring the healthcare system back. Kyrgyzstan is still trying to get their healthcare system back up and try to provide to the citizens as much as possible. They sure have a long way to go. Thanks for watching.
Created using Powtoon.